Good day. Thank you for joining this discussion of the Bipartisan Policy Center's Food and Nutrition Security Task Force report that we issued just last week. That was entitled Strengthening the Child Nutrition Programs. I think you're going to really enjoy this discussion. I am Bill Hoagland, Senior Vice President here with the Center, and have the pleasure of working with our economic and health team on various public policy issues confronting policymakers today. You can also join this conversation with your comments or questions using the live chat on the YouTube or Facebook, or on Twitter using hashtag BPC Live. We have a large audience, and you will understand if we cannot get to all of you, but feel free to reach out to me or members of our staff with your thoughts if we don't get to your questions today. One of the founders of the Bipartisan Policy Center, who recently passed away, was Senator Bob Dole. He was a passionate proponent of ensuring all Americans, and children particularly, had access to good food, healthy food. In the 1970s, he worked with Senator George McGovern to address hunger in the U.S. by reforming the food stamp program, now known as SNAP, of course. He worked with Senator Hubert Humphrey to help create the Women's, Infants, and Children's program, WIC, definitely all bipartisan efforts. The federal child nutrition programs, the school lunch, school breakfast, summer feeding, special milk, WIC, and others, were last authorized over a decade ago. That legislation, known as Health Hunger Free Kids Act of 2010, passed the United States Senate unanimously. Now to me, that's really bipartisanship. The time has long passed to provide an updated authorization for these programs. Once again, the programs that serve over nearly 30 million children daily. We created the Food and Nutrition Security Task Force earlier last year, and this is the second of what will be 3 policy briefs. Last September, the task force issued its first set of recommendations surrounding the impact of the pandemic on food and nutrition security. The task force is led by 4 co-chairs. We could put up that slide. You will hear from all of them shortly. And 14 very distinguished individuals from academia, food and agriculture sector, the health sector, and the advocacy community. Time doesn't allow me to mention them all by name, but you can see who they are and who they representations of their organizations. But besides the co-chairs, you will hear from 4 of the task force members today as they discuss their 13 broad bipartisan recommendations. By the way, I'm happy to say that USDA last Friday announced an update to the school nutrition standards for the upcoming 22-23 school year. And many of those follow some of the recommendations of this task force that you're going to hear from today. So without further ado, let me turn this over to one of the co-chairs who really needs no introduction. Chef Jose Andres is a world-renowned chef and humanitarian and founder of the 4-star nonprofit World Central Kitchen. The mission of the World Central Kitchen is to be there on the ground, providing food and, quite frankly, hope when disaster strikes, many times even before the government can get there with its assistance. Whether it be a volcano off the coast of his beloved Spain in the Canary Islands, to hurricanes or tornadoes ravishing New Orleans, Puerto Rico, Haiti, Texas, the Carolinas, Kentucky, Tennessee, and now most recently to the people of Tonga. He is there giving food and assistance. Thank you, Chef, for finding time in your unbelievable schedule to work with us and your support to the policy work of the task force. Chef?
All right, doing this all through the pandemic, and now I forgot to press mute. So thank you, Bill. Welcome everybody, and good morning to my fellow BPC co-chairs, task force members and the many hundreds of people all around the country who are tuning in. You know, no matter your sector or background, nutrition advocates, academic researchers, policy analysts, private sector allies, partners from faith-based organizations, journalists, you name it. That fact that you are joining us today is a testament to the size and the strength of our movement to end hunger and improve nutrition security here in America and, why not, around the world. You know, COVID-19 has made us more aware of the root causes of food insecurity and lack of equal access to nutritious food. A few months ago, this task force issued our first round of recommendations related to pandemic recovery and using food policy as a way to build back healthier communities. Today, we turn to another topic that I know is important to each and every one of you: child nutrition. When we talk about a bright future for our country, there is nothing more essential than ensuring we give our children every opportunity to grow and develop into healthy, productive members of society. So I am proud to highlight a few of the recommendations that we've made for Congress, the White House, and allies in the nonprofit and private sector to strengthen child nutrition in the upcoming Child Nutrition Reauthorization and beyond. Ensure all children, regardless of household income, has access to nutritious foods to allow them to learn and grow by providing a school breakfast, a school lunch, after school meals, and summer meals to all students at no cost. We believe, that access to food is a universal human right, and I know you do too. Universal school meals is the best investment we can make now for the future health, national security, equity, and prosperity of our country. Strengthen the quality of nutrition in school food programs. We must. Let's promote cooking efforts that include nutrient-rich foods aligned with the dietary guidelines. No-brainer. Scratch cooking and better school kitchen infrastructure give us the power to make 360-degree investments in communities across the country, buying from local farms, creating jobs with dignity, not only feeding our children better quality food, but empowering them with nutrition education. And we cannot forget that in times of crisis, schools become a central point for communities to seek shelter and sustenance. With better school cafeterias, organizations like World Central Kitchen are able to respond to emergencies to make sure that food is not part of the problem, but that food finally becomes part of the solution. And finally, we must expand access to out-of-school nutrition programs. Over the past several years, also World Central Kitchen has worked to fight child nutrition insecurity in hundreds of cities across nearly all 50 states. We've seen that some of the most complex problems, they have very simple solutions. We have enough nutritious food to feed every child in America, in our schools and in our communities. We have the technology and the systems of distributions to make sure not one child is forgotten. And we know which policies and flexibilities that are needed to get it done. What we need is the political will to commit to ending child hunger once and for all. And I hope those of you listening to this briefing today will join us in that commitment and hold our elected officials accountable to that same promise. To finish, if we want to truly address the problem of child nutrition, we must be out there in our communities with boots on the ground, and at the same time, finding opportunities to break bread and come up with practical solutions in a bipartisan way, like we are doing here today, building longer tables, my friends. So with that, I'm super excited to introduce you two of my co-chairs in this effort, Secretary Ann Beneman and Secretary Dan Glickman, to present our recommendations in greater detail. Secretaries, the floor is yours.
Well, Jose, I'll start. First of all, it's impossible to follow your enthusiasm and your infectious commitment to feeding a hungry world. When you look in the dictionary under the word humanitarian, you see the picture, Jose Andres. And so I'm just honored to be in the group along with the other four co-chairs. So to talk a little bit further about what both Jose and Bill Hoagland said, the task force made 13 recommendations for strengthening the child nutrition programs. And many of these recommendations can be accomplished through reauthorization of the Child Nutrition Act. But even without that act, there are actions Congress, federal agencies, and the private sector and nonprofit can do to it. So Secretary Ann Beneman and I are going to take the next few minutes to give you an overview of the recommendations of the task force, which we think are so important. And I'll start with about half of them, and I'll turn it over to my colleague Ann Beneman to take the other half. But if you haven't already, I encourage you to read our full report, Strengthening the Child Nutrition Programs, on the BPC's website and in the invitation for this event. So if we could go to slide 5, our policy recommendations address 4 key areas. Number 1, strengthening nutrition and food security in schools. And then the second is strengthening it out of schools, including the summer meals program and the child and adult care food program. Also strengthening in the WIC program, which is another area that's for the very successful program for pregnant and postpartum women, infants, and young children at risk. And then the final recommendation is across program areas. How do we deal with the bureaucracy and the turf that sometimes happens when major programs get announced and implemented? So we are the Food and Nutrition Security Task Force, and the policy recommendations address both food security and nutrition security. So in school, the first set of recommendations is to ensure that all children have access to nutritious foods by providing school breakfast, school lunch, after school meals, and summer meals to all students at no cost. This is a profound recommendation. We'll talk a little further about that later. Number 2 is strengthening nutrition in the school nutrition program, strengthening nutrition itself. It's not just the quantity of food, it's the quality of food and the nutritious nature of it. Number 3 is strengthening nutrition education in schools. And number 4 is supporting investments in kitchen equipment and infrastructure, which Chef Andres talked a little bit about in his remarks. So in terms of our 4 recommendations focused on schools, our first recommendation is for healthy school meals for all students, also called universal meals. Providing healthy school meals for all is the current policy nationwide due to COVID-19 waivers. Evidence is accumulating of its many benefits, including improving diet quality, improving academic performance of kids, eliminating unpaid meal debt, improving food security, promoting equity, and reducing unpaid meal debt. However, while many healthy school meals is the long-term goal, we recognize that it is costly. It does cost tens of billions of dollars. And so this may have to take place over a longer period of time and may not be politically feasible in the very short term. BPC has estimated the cost of providing school lunch and breakfast for all to be about anywhere between $60 to $96 billion over 10 years. So, but we want to move in that goal. That's a very high priority in these recommendations. Other policy options to increase access to school meals include additional investments and enhancements in community eligibility provision that allows all students in some districts to receive free school meals. Number 2 is to improve direct certification and categorical eligibility, to require food authorities in the school meals program to prohibit lunch shaming or stigmatization in their unpaid meal debt policies, and to incentivize schools to serve meals in alternative ways, such as breakfast in the classroom, to increase participation in the programs. Our second recommendation is to strengthen nutrition in the school nutrition programs. The task force provides several recommendations for strengthening nutrition in the school nutrition programs. We have estimated and some of these, some of these include maintaining and strengthening nutrition standards for all foods and beverages provided through the school nutrition programs to better align them with the latest dietary guidelines for Americans, to provide technical assistance, funding, and promote scratch cooking where feasible, and to expand the fresh fruit and vegetable program. And the recent USDA announcement does go a long way in this direction. Our third recommendation is to strengthen nutrition education in schools by providing opportunities for experiential or hands-on learning, such as through the farm to school program, school gardens, or culinary programs. And our fourth recommendation is to support investments in kitchen equipment. We think all of these will go a long way to deal with the school issue: nutrition, healthier kids, and better education. Our recommendation number 5 is to expand access to out-of-school nutrition programs. And our recommendation number 6 is to make summer EBT, or the electric benefit transfer card, a permanent program and allow students to access EBT benefits during school breaks, holidays, closures, and other emergencies. So if we could go to slide 7, the task force also has 2 recommendations to strengthen food and nutrition security through out-of-school programs. Recommendation number 5 is to expand access to out-of-school nutrition programs, including the summer meals program and the child and adult care food program. Currently, only about 1 in 7 low-income students are participating in the National School Lunch Program during the school year participates in the summer food service program. Some options recommended by the task force to expand access to out-of-school nutrition programs focus on: 1, decreasing or eliminating area eligibility thresholds that currently exist; number 2, to allow summer meals programs operators to provide meals in a non-congregate setting if it is a barrier to accessing the program; and number 3, to permit summer food service program sponsors to operate year-round. So this is a lot of stuff, but it's all very important because it has to do with making our school meals programs and related programs do their best to feed nutritiously our kids during the most important periods of their life. So with that, I'm going to turn over the program right now to my colleague and my successor at USDA, Ann Veneman.
Well, thank you very much, Secretary Hurtling. It is always a pleasure to be working with you on these various public policy initiatives. So as was indicated, I'm going to present the second half of the task force's policy recommendations. Our recommendations are focused on both strengthening nutrition and improving technology in the WIC program. Recommendation 7 is to enhance the value of the WIC benefit, expand program eligibility, streamline certifications, and strengthen nutrition and breastfeeding programs. WIC is key to improving the diets and health of the more than 6 million low-income women, infants, and children who participate in the program each month. Ways to strengthen nutrition in WIC that the task identified by the task force include permanently increasing the overall value of the WIC food package and better aligning it with recommendations from the National Academies of Sciences, Engineering, and Medicine and the dietary guidelines. Permanently increase the cash value benefit for fruits and vegetables, streamline certification periods, and enhance adjunctive eligibility to bolster child retention, increase breastfeeding support through the breastfeeding peer counselor program. And then we move to recommendation 8, which is to utilize technology to modernize delivery, increase program participation and retention, improve the WIC shopping experience, and to make redemption of WIC benefits easier. Some of these policy options to improve technology in the WIC program include permanently allow remote services building on the lessons learned from the pandemic. Second, facilitate WIC's transition to online purchasing so that WIC participants can redeem benefits online, just like SNAP and in the commercial marketplace. And modernize the WIC Farmers Market Nutrition Program. Increase access to affordable, high-quality broadband so that participants can more easily access the program and its components. And then moving on to the recommendations 9 and 10, there are 5 recommendations across programs focused on ways to better enhance or integrate multiple child nutrition and health programs. Recommendation 9, maintain or strengthen nutrition standards for all programs to better align them with the dietary guidelines for Americans. Given that child nutrition programs were established and are often updated at different times, their nutrition requirements vary. The task force recommends that nutrition standards for the child nutrition programs be maintained to better align them with the most recent edition of the Dietary Guidelines for Americans. Recommendation 10 is to streamline and facilitate eligibility, enrollment, and data sharing across programs that address food and nutrition insecurity and other social determinants of health. Many low-income individuals and families are eligible for multiple food and social service programs, but there are barriers to enrollment. One way to overcome these barriers is to streamline and facilitate eligibility, enrollment, and data sharing across these various programs. This change would create a one-stop shop for application and enrollment in federal food, nutrition, and other social service programs, utilizing policies like broad-based categorical eligibility to allow families who participate in one federal program to participate in another without having to file additional applications. Recommendation 11 is to support and increase the accessibility, affordability, and intake of fruits and vegetables in child nutrition programs. The Dietary Guidelines for Americans recommends that people ages 2 and older make half of their plate a variety of fruits and vegetables. Most children and adults fall far short of meeting this recommendation. Ways to increase fruit and vegetable intake through the child nutrition programs include providing an additional monthly benefit for fruits and vegetables in federal child nutrition programs that utilize an EBT card such as WIC and Summer EBT. It is important to note that the task force recommendation is focused on increasing intake of fruits and vegetables in all forms, including fresh, frozen, and canned. Recommendation 12 is to strengthen research investment and data collection across federal agencies to identify rates of and interconnections among food and nutrition insecurity, diet quality, program participation, and other outcomes, including academic performance, chronic disease, and later performance in the workforce, and eligibility for the military, as well as barriers to participation in child nutrition programs. Recommendation 13 is focused on improving children's food and nutrition security in the healthcare sector through congressional, government agency, and private sector collaborations. Opportunities include utilizing data sharing and increasing outreach to improve participation, creating a healthy food prescription pilot grant program, increasing access to and insurance coverage for dietitians and breastfeeding peer counselors, making investments in nutrition and public health initiatives that could reduce treatment costs for diet-related chronic conditions, and adjusting the Congressional Budget Office scoring window for certain prevention-focused initiatives beyond 10 years. So this concludes our recommendations from the report. And we are now going to have a very interesting panel discussion led by our fourth co-chair, Leslie Saracen. Leslie?
Thank you, Secretary Veneman. It's a pleasure to be with everyone today. And I share the enthusiasm for the recommendations as well as the work of the task force that you've heard from my fellow co-chairs. It's been an interesting and productive process, and I think all of us have learned a lot as we've gone through it. I thought I'd start first by just providing a brief perspective from the food industry on what has been included in this report and what the recommendations are. So let me start by saying that the retail food sector, the grocery industry, and the food industry more broadly plays a really critical role in federal nutrition programs, including WIC. And I think it's this public-private partnership between the grocery industry and federal and state governments that gives us one of the best examples, perhaps, of a successful private public partnership. So it's one that we in the industry enjoy being a part of very much, and are happy to contribute to the benefits and the value that is brought to society. The second thing I would say is that the industry is certainly supportive of increasing accessibility, affordability, and intake of fruits and vegetables. And say fruits and vegetables, as Secretary Veneman indicated, what I'm referring to here is fruits and vegetables in all forms, whether it's fresh, frozen, or canned. And I think those are important options for our consumers, and particularly children, to have access to. The food industry supports strengthening nutrition standards for all programs to better align them with the latest dietary guidelines for Americans. And this is something that I know Secretary Glickman mentioned. It's an important part of what we're talking about here, because it helps us leverage evidence-based approaches to nutrition and healthy eating patterns that will improve the overall well-being of children receiving food assistance. Food retailers have embraced innovation and are supportive of utilizing technology to further modernize the federal nutrition programs. And retailers are also committed to working with USDA and beneficiaries of the programs to make the programs easier to access and participate in. So these are things we're committed to as we move forward. We are very fortunate today to have a panel of individuals who bring unique perspectives to this issue, very esteemed individuals that we've had the pleasure of working closely with, and I'm looking forward to having a conversation with them today. I'm going to begin by asking some questions of them after I introduce them, and then, of course, those of you who are participating and watching from outside can participate also by asking questions yourselves, and you can do that through the live chat on YouTube and Facebook, or on Twitter by using hashtag BPCLive. So I will share that with you again when we get into the opportunity for you all to be able to participate in that. So let me say, first of all, how pleased I am to have our panelists with us today. I'm going to do a brief introduction, and then panelists, if I miss anything important that you want to say about yourself when I defer to you, please feel free to include it. So first of all, we're joined by Rochelle Davis. Rochelle is the founding president and CEO of the Healthy Schools campaign, where she oversees all aspects of the organization's mission to make schools healthier places for all students. Rochelle brings deep experience in children's health, education, food access, wellness, and environmental health issues to her role. So Rochelle, welcome. We're delighted to have you.
Thank you.
Next, we have Dr. Nadine Gracia. She is president and CEO at Trust for America's Health, where she works to promote sound public health policy, advance health equity, address the social determinants of health, and she brings awareness to health promotion and disease prevention. She has extensive leadership and management experience in federal government, professional associations, academia, and clinical practice. So welcome, Dr. Gracia. We're glad to have you with us as well. Next, we have the Reverend Douglas Greenaway. Reverend Greenaway only recently retired from the National WIC Association just earlier this year, after having served as the association's president and CEO for more than 3 decades. So clearly he has a long history in dealing with these issues. As many of you are aware, the National WIC Association is the nonprofit education arm and advocacy voice of the more than 6.3 million mothers and young children participating in WIC, the Special Supplemental Nutrition Program for women's, infants, and children, and the nation's more than 12,000 WIC service provider agencies and clinics. So Reverend Greenaway, welcome. Delighted to have you as well. And last but not least, we have someone that I have really come to admire and have learned so much from in this work on the task force. Lieutenant General Mark Hurtling is with us. Lieutenant General Hurtling retired from the military in 2013, having served in the U.S. Army for 4 decades. He finished his Army career as the commanding general of U.S. Army Europe. He served a total of 38 months in combat, including a tour commanding the U.S. Army's 1st Armored Division and Task Force Iron in northern Iraq for 15 months during the surge. More recently, he serves as an advisor to the nonprofit organization's Mission Readiness in California, Operation Gratitude in Washington, D.C. So, Lieutenant General Hurtling, we're delighted to have you with us as well. So I think what I'd like to ask each of you, and if it's okay, I'll start with you, Rochelle. My question for each of you, and we'll take it in turn, is why do you believe now is a critical time to reauthorize child nutrition programs? What is unique about this time that makes it so essential? Rochelle?
Well, thank you. So I think that right now, the pandemic has really underscored the really critical role that the school meal program has played, but it's also highlighted the need for reform by shining a spotlight on the complexities of the rules and regulations, and also the need to strengthen the financial basis of the program. And the pandemic in general, and the last few months in particular, have really been challenging. Food service staff have had to deal with higher food costs, disruptive supply chains, unpredictable school schedules, and labor shortages, and have shown remarkable and commendable dedication to making sure that students have fed. And while the USDA has taken many steps to address this situation, congressional action is needed. You know, I think that and also, as Secretary Glickman talked about, you know, we also really need to make sure that the food that we're serving our children is aligned with the best of science and the dietary guidelines. And our children have suffered so many health setbacks during the last 2 years that we really need to bring the meals that we're serving them into alignment.
Much. Reverend Greenaway, what's your take on why this is so important right now?
Well, Leslie, thank you very much for the opportunity to share my perspective, and also to thank my colleagues on the Nutrition Task Force for their support of the WIC program and these recommendations. I join with Rochelle Davis and say that really the pandemic has heightened the need for change in the WIC program. We have seen successful upticks in participation as a result of remote access. We have seen increased consumption of fruits and vegetables as a result of infusion of resources through the American Rescue Plan. And so these 2 significant changes in the program, we see an importance of codifying those in a more permanent way through reauthorization.
Thank you, Reverend Greenaway. And Dr. Gracia, do you agree that this is an important time to do this? And what do you think about the opportunity to, as the Reverend just indicated, codify some of the waivers and things that have been put in place during these unusual times we've been living in?
Absolutely, Leslie, and it truly is a pleasure to be with all of the fellow members of the task force. I echo certainly what Rochelle and Rev Greenaway have articulated in particular with regards to the impact and what has been highlighted through the COVID-19 pandemic. Approaching this through the lens of public health, the organization that I lead, Trust for America's Health, specifically focusing on public health policy. We've seen the toll that the pandemic has taken as it relates to lives lost, as well as the economic impact. What the pandemic has also highlighted and truly exposed and exacerbated are the underlying social and economic inequities that also exist in our systems that are disproportionately impacted far too many families and communities. And when we look at this in the context of our nation's children, that has deeply impacted them, from the school closures to disruptions in their daily routines to increased stress, as well as lack of availability of healthy and nutritious foods and lack of access to physical activity. And what we've seen as a consequence and contributing factor is increased weight gain, as an example, during the pandemic, and increased food insecurity. So this is an unparalleled and unprecedented time for us to truly strengthen and address the fragmentation of the systems, where we continue to see a need to strengthen a whole host of areas, from our school nutrition standards to the variety of the school and federal nutrition programs, to assure that everyone, all children, have a fair and just opportunity to be as healthy as possible, because it impacts not only their short-term health and well-being, but their long-term health, well-being, and opportunity as it relates to long-term chronic diseases, to also issues related to higher educational attainment and economic opportunity. So this is a paramount opportunity for us to really drive forward transformative policy change to help support our nation's children.
Thank you so much, Dr. Gracia. I'm glad you brought up your reference to the longer term ramifications of childhood nutrition. And Lieutenant General, I'd like to call on you to talk a little bit about that. I've been so intrigued by some of the background and expertise that you've brought to these discussions. One of the things that we say at FMI is that food security equals national security. And I suspect that you agree with that comment. And so could you talk to us a little bit about, we heard a lot of detail on the 13 policy recommendations from the secretaries. From your perspective and the role that you're playing currently and what you've seen throughout your career, why are these recommendations so important? And of the 13, which are the ones that you think are so important for children because they will help with this long-term effect on their lives as they grow older and perhaps move into military careers?
Well, I'll answer your last question first, Leslie, but first I'd like to say thank you for allowing me. Recommendation number 12 is the one that I would focus on, because it has to do with. Oh, I'm sorry. I want to thank Leslie for the introduction, but also say that it's an honor to be as part of this panel, because I feel overwhelmed by the knowledge and the passion of all the people on the bipartisan commission, but especially the folks who are talking now. Leslie, what I'd say, I'd answer your last question first and say that policy item number 12, the one that talks about research, because I think the knowledge associated with what we're seeing in our society would ensure that people would support all of the other recommendations. I'll also have to basically say, there may be some people that are saying, why the heck is a former retired soldier part of this commission in the first place? Because it's a bit unusual to hear national security and food security discussed together. But there's a story behind how I got involved, and I hope you don't mind, I'll tell it briefly right now. Coming out of Iraq as a division commander in 2008, my next assignment was commanding the Army's Initial Military Training Command. This is an organization that was recruiting and training about 160,000 new soldiers every year. It was there that I saw the effects of poor nutrition, obesity, and a lack of physical fitness in young men and women who were joining the Army. I also learned from recruiters that only a small number of those desiring to enter the service were qualified to do so. According to Department of Defense statistics today, This is today, not then. That was 10 years ago. 71% of our nation's 17 to 24-year-olds are ineligible to enlist in the military due to poor health, lack of education, or a record of crime or drug abuse. And about a third of those Americans between 17 and 24 can't meet the military's core eligibility requirements due to obesity, which is a form of malnutrition that is caused by food insecurity and physical inactivity. We started conducting extensive research on the state of the new recruits that did make it into the Army, and we were shocked as to their eating habits as young men and women. We found there was significant correlation between poor nutrition and a lack of physical fitness, and with a new soldier's ability to complete even the 10 weeks of basic training. There was a higher correlation between poor nutrition and the extremely costly debilitating injuries that we had to treat, not the American healthcare system, but the military healthcare system that had to treat the injuries associated with poor bone growth, bad muscles, all as a result of poor nutrition. Now, that's still plaguing the military. And because I have a master's degree in exercise physiology, I saw the connection, and it even became a part of my second career because I'm now working in healthcare. I'm very interested in all this. As I said, 71% of our nation's youth are not fit enough to serve in the military. Most of that is a result of bad nutrition. So from a soldier standpoint, I believe we need the legislative action on all the recommendations to address fixing these issues. And the programs that were briefed earlier by the two secretaries will certainly go a long way in helping stop the downward spiral of nutritional insecurity.
Thank you so much. Those numbers, every time I hear you say them, it's almost unbelievable. The statistics are just stunning. So thank you for sharing those with our audience today. Dr. Gracia, what we have just heard what the long-term ramifications are of, at least some of the long-term ramifications are of not focusing as we should perhaps on child nutrition. What do you think the biggest challenge is today in child nutrition? And how do you think these recommendations will help address that?
Thank you for that question, Leslie. And I think it's, one we can point to, as you noted, long-term challenges and issues we can see, but there's also the short-term as well, with regards to lack of access to healthy and nutritious foods that impact children in school. Talking about health, well-being, and opportunity, we have to look at where children are in school and the opportunities that they have to access healthy and nutritious foods, because that impacts their development, that impacts their ability to learn, that impacts whether they have higher risk for conditions such as overweight and obesity, type 2 diabetes, even in the short term. And so when thinking about what some of the challenges and barriers are, is really understanding that this really requires multiple sectors to be engaged to address assuring that children have access to healthy nutrition. Certainly working within the educational system, but all sectors really have an important role to play. One of the areas we can see is actually that there are indeed the vast number of programs is actually trying to bring even greater coordination across programs to ensuring that youth who are eligible for a host of these services and supports actually are getting access to them. You've heard about the number of students and youth, for example, who have access to the National School Lunch Program, but aren't enrolled in, for example, the summer feeding program. How we can actually bring greater coordination and assuring not only eligibility, but enrollment in those programs and making it easier on families. We're talking about families that, for example, have been disproportionately on the front lines of working in the COVID-19 pandemic. When we look, for example, at households with children or Black households that saw rises of food insecurity in their homes, and trying to ask them to be able to enroll in multiple different programs where they have different application processes, or if those applications are cumbersome for school districts to be able to engage in, how we can actually try to address those administrative challenges as well as the outreach and engagement to assure that they have access to those types of programs. I think some of the recommendations in particular are addressing that, for example, through the data sharing that we can do across programs to ensure that the students, especially that are most in need, have access to the resources and supports that they should have, and that we assure that those types of administrative barriers that challenge school districts and other school administrators to be able to implement these programs and modernize these programs is critically important. And that's what many of these recommendations in the policy brief are addressing.
Thank you so much for that. Rochelle, we've talked a lot about healthy meals in the school programs, and the task force has clearly recommended that the waivers that are in place now be made permanent. What, from your perspective and from what you see, what are the benefits of healthy school meals for all, and for universal meals for all the students who are engaged in the meals program? And given the uncertainty of the duration of the public health emergency, I think at this point we're now expecting that if no further action is taken, that will end in April. How do you believe Congress can best ensure access to school meals in a fiscally responsible way? Because as always, it's not just about what we wish would happen, but also what we could afford to make happen. So how can that happen from your perspective?
Well, Leslie, thank you for that question. I feel like there were a number of questions in there, but I first would like to just make a clarification about waivers. The USDA has given schools a lot of waivers, and some have related to access, and some have been related to nutritional standards, and some have been related to how meals are served. And our recommendations are that we are calling to make permanent are specifically those relating to healthy meals for all, or extending access, and are not relating to the waivers on nutritional standards. And I think that moving school districts from where they have been for now 2 years of having those waivers on nutritional standards to going back to serving healthy meals is a really critical and important challenge. And the action that the USDA took last Friday was a first important step in trying to move school districts back towards meeting some level of nutritional standards during this really critical time. And I'm by no means implying that schools have been ignoring them. They've been facing really difficult challenges. So just wanted to kind of clarify that waiver comment. But to your question about the importance of healthy meals for all, or universal meals, you know, and how to think about this in a fiscally responsible way. I think that really the question is, how can we afford not to do this? How can we afford not to invest in making sure that our young people have access to healthy food, are given a chance to learn, are given a chance to grow healthy? I think that a big challenge that we face in our country is just investing in prevention. We're certainly overall dealing with that challenge in general, but thinking longer term about the future of our country, the future of and making investments now that will benefit us, and investing in our children is certainly really important. And those investments might not pay back in the next quarter or the next 3 years, but we are going to rely on these young people to guide us into the future. And we cannot afford to have a significant number of them move into adulthood, having missed critical critical opportunities to learn, and critical opportunities to be healthy, and critical opportunities to thrive. And so I think the question, you know, I think that the challenge is for our political leaders to think more holistically about all of the costs associated with not making this investment. And so that is kind of the big picture challenge and question I would pose. I think that, more narrowly, it also just makes more sense in terms of a lot of the issues that Secretary Glickman raised at the beginning of the presentation, about reducing administrative burden and letting the resources be spent not on certifying children and all the administrative work, but putting that money into delivering healthy meals. We also know that particularly right now, families are moving in and out of changing financial economic statuses of families, and they may not know how to navigate these systems, and making it easy and seamless for young people is very, very critical. And so I think there are both some short-term and immediate reasons why this should be done, and some very, very compelling long-term benefits for doing this.
Well said. Thank you very much. Appreciate your comments on that. I suspect, Reverend Greenaway, you might have some thoughts on that subject as well. And so I'll ask you to answer that, but I'll also ask you to share with us the answer to another question at the same time. And that is, after 30 years in your role, you've had a lot of experience in dealing with reauthorization bills and other challenges in the public policy domain. And I know that you share my view that we rarely end up at the place that we think we're going to, or certainly where we hope we will when we begin. But one of the things that I'd be curious about hearing from you is, from where you sit, what do you think a successful child nutrition reauthorization might look like in the environment that we're in right now?
Thank you, Leslie, for those questions. I'm going to follow up on Rochelle just for a moment and say that, for Congress not to make the decision to invest in the well-being and health of nutritional health and well-being of children is just a grievous error or mistake. So, when we think about every dollar we invest in the WIC program returns savings in healthcare up to $2.48. It just makes good investment sense. Right now, as we look at stock markets tumbling, I think all of us would like to get that kind of return on our investment. So it makes absolute good sense to choose children and quality nutrition for children and their families first. I think successful nutrition successful reauthorization prioritizes children and families and quality health and nutrition for them. And I want to underscore your comments about the public partnership that we have in the WIC program. It's been successful for almost 50 years now, and is the perfect example of a program that Congress has founded bipartisanly, grown bipartisanly, and invested in the science of nutrition to assure that the food packages that we have in the program and the partnership that we have with the retail grocery industry assures that we're delivering quality nutrition at the end of the day to mothers and their children. We know that we get healthy birth outcomes from participation in the WIC program. So doing things like extending certification periods for postpartum mothers in the program, and extending certification for children, infants in the program up to 2 years. Those really ensure that their nutritional foundation prepares the children to succeed successfully when they enter school, and that in that period between pregnancies, that mothers have a healthier birth outcome, and the end result is healthier infants, healthier children, and reduced healthcare costs. So I think we've got a lot of legislative vehicles that are moving forward now, whether it's through appropriations or the Build Back Better Act, the waiver pieces around the COVID pandemic, but really codifying these in through child nutrition reauthorization is really critical to assure that these are permanent changes and not just in the moment changes because of some particular legislative crisis or healthcare crisis that we might have. So I hope that responds, Leslie, to your questions.
Thank you so much. This notion of public-private partnerships is one that certainly in the food industry we value very much. Lieutenant General Hurtling, from your perspective, you obviously in your career have spent a lot of time focusing on many of the public programs. In your experience, are there things that the private sector should be or could be doing differently to help aid in strengthening child nutrition programs? What else can we on the private sector do to be helpful in this process?
In the past, Leslie, thank you for that question. In the past, I know the President's Council on Fitness, you changed their title actually from President's Council on Fitness to nutrition, to add nutrition and sport along with that during the Obama administration. And I know many of the people that were working with that organization were actually interacting with restaurateurs, with cafeterias, with the kinds of organizations that saw the requirement for healthy food to be the emphasis, both on the store shelves and in the restaurants. Truthfully, did not get a whole lot of traction on that, a lot of work, but not a whole lot of movement. But I think that's the critical piece of this. There's also the requirements, I believe, now working in healthcare to get healthcare systems and organizations involved with this, specifically for the comments that Dr. Garcia made and the Reverend made about what do we do in terms of prevention of sickness as opposed to just curing it associated with insufficient health. So I know from a healthcare perspective, they want to get literally in front of any disease and maladies that they're seeing just an increasing amount of problems with. So the best way to do it is to say, how does nutrition contribute to that improvement in overall health? And I think there are just tons of research available that shows exactly how that does occur. The other thing that I'd say, one of the things we learned when we did incorporate better nutrition, first in basic training, but then later on in Department of Defense schools in Europe, was that we saw some studies that showed an improvement not only in critical thinking and performance, but also a massive reduction in injuries and illnesses. So I think, again, that's why I go back to that item number 12 that talks about a greater reliance on various health industries doing research on the improvement of health across the board within our society, because it's all tied together. As Rochelle said, the long-term problems that we're experiencing in healthcare, as well as the health of our nation, are tied, at least in part, and I would suggest a large part, to nutrition insecurity. So it is an important thing for our society, as well as for each individual affected by this particular cause.
Thank you for that. These conversations about all of these issues necessarily, I think, and Dr. Gracia, you referred to this, I think, a little bit in your previous answer about equity. Talk to us a little bit about how you think the child nutrition reauthorization can be structured so that it better promotes equity in the child nutrition programs.
Absolutely. I think one is an understanding of equity being that fair and just opportunity for everyone to be as healthy as possible. And so when we think about it through that lens and have an understanding that as these programs are providing important sources of support and nutrition and food for our nation's youth, is understanding some of the challenges that families may face, whether that's indicating that there's online purchasing, ensuring that families have access to broadband to be able to actually do online purchasing. When we talk about WIC, for example, and where certain eligibility requires in-person appointments, having the flexibility, whether that we can have broader terms for certification so that that families don't have to be able to go to an on-site location each year, which may be a burden and challenge for families. Understanding that their working hours may not coincide to the working hours of various sites that are providing these services. And again, understanding that when we see not only transportation issues, but also assuring that outreach is done in a way that is culturally responsive and respectful of the communities that we're doing that outreach to. These are all important ways that as we think about designing and implementing the policies within a child nutrition reauthorization, that it can truly help to advance equity. For far too long, there are so many families that really this is out of reach for them because they are grappling with these broader conditions in which we see structural barriers from transportation to accessing the services that may promote children falling through the cracks. And so certainly that's why through a public health lens, when we take that holistic approach and also looking at issues around ensuring that children know that they're valued to be able to access this, we see that the disparities with regards to accessing these programs, it's critically important. But I think the investment has to be there, as Rochelle has said, with regards to accessing and assuring that we're investing in children and prevention. These inequities did not happen overnight. And so that investment means it has to be long-term investment so that we can actually see health and well-being be prioritized, especially for our nation's youth.
Thank you, Dr. Gracia. You know, this notion of investment is an important one that has come up several times during the conversation this afternoon. And we've also had a question from the audience that also asked about investment. And the question is whether there are any of the recommendations coming out of the task force that involve investing in the recruitment and or retention of kitchen and school nutrition staff. And this writer says more staff equals more capacity to source and prepare local healthy food. I guess I would respond to that by saying that, of course, it is addressed as part of recommendation number 4, which is focused on school kitchen equipment infrastructure. And there's a reference in the recommendation itself that additional funding could also go toward enlarging and training the school nutrition workforce. Training could address how to plan and prepare tasty and nutritious meals and how to manage a fresh foods inventory. Is there anything any of you would like to add to that question?
Well,
Please, Rochelle.
I think that, you know, in general, taken as a whole, the recommendations would strengthen the school meal program and would address a lot of the challenges and barriers that school food service directors are facing right now that make it a very difficult and challenging job. If, first of all, universal free meals would create some regulatory certainty, child nutrition in general would create regulatory certainty. The universal free meals would financially strengthen the program, reduce administrative burden, allow more students to be served, which, you know, volume that creates more financial stability, more capacity, more resources to improve facilities, more educational opportunities for students so that when they come to the cafeteria, they're not looking at things and saying, you want me to eat that? I mean, they're more knowledgeable and they're more open. And these are real life challenges that food service staff, both frontline and back kitchen staff face. And so while it doesn't directly address that, and maybe that was an oversight on our part, strengthening the overall program, normalizing a lot of the regulations and the nutritional standards, I think will go a long way to supporting a more stable workforce.
Leslie, if I might add a comment.
Yes, Reverend.
I mean, I think across the nutrition programs, there are staffing challenges, and I want to speak specifically to WIC. You know, in local agencies, many of the staff are doubling up on responsibilities, and the pandemic has impacted their ability to provide fully the services that they'd like to provide. And I think there are also issues, significant issues of wages and salaries for workers, particularly on the front lines in WIC clinics and in school lunch programs as well. And so we really need to devote energy, resources to identifying these challenges and assuring that clinics, school lunch programs have adequate staff to deliver the kind of services that mothers and their families and are expecting when they participate in these programs. And so it's really a recognition of the significant contribution that these staff are making to the success of these nutrition programs. It's not simply about enhancing the value of the WIC food package, which is absolutely critical in this time, but it's also assuring that the folks who are delivering these services have the support they need in terms of training and adequate complement of staff.
Thank you. Lieutenant General, did you have a comment you wanted to make?
Yeah, I was just going to say that during our transfer of the basic training dining facilities, what most people would consider to be our old mess halls, there was significant action taking place across the board that had to do with not only changing the way we fed our new soldiers, but the second and third order effects of taking out, and I'll give a few examples. We took out all the deep fat fryers across the board in our mess halls across the country in basic training to try and give better food. That seems like a small thing, but it was huge in terms of the second and third order effects of reducing the amount of grease that was in food and improving the nutritional quality as well. We balanced the number of soda dispensers with flavored water dispensers, which seems like a relatively small thing, but we were seeing the amount of dental requirements we had with our new basic trainees from a lifetime before entering the services of drinking soda instead of milk and energy drinks instead of water. Those are the kinds of things we have to shift our attention to with regard to within our schools, and the educated population that feed our students are the same kind of things we saw in basic training. Now, what I will tell you, there was a good news story to this. One of the commanders of one of our basic training units had a wife who was a nutritionist who fortunately followed me to Europe when I took command of US Army in Europe. And she started applying all of these same kind of things to the DoD schools on her own. And what she found was the nutritionist and the cafeteria workers at the school were delighted by the fact that they could start feeding the children good food as opposed to the kinds of things we currently serve in many of our schools.
Thank you for that. We've had another question from the audience. And the question is, it's been 10 years since Congress authorized child nutrition programs. What are you hearing about Senate Agriculture and House Education and Labor actually producing a bill? Reverend Greenaway, you want to start us off on that one?
Well, my crystal ball is really murky on that one. But this is related, and there is the possibility of rather soon action, I believe, and that is that it's in the power of the administration and Secretary Vilsack to issue proposed regulations soon to transform the WIC food packages, to update them and to increase the overall value of those WIC food packages and enhance the value by ensuring that the increase in fruits and vegetables is included in those recommendations. So I want to urge USDA to get that rule out, proposed rule out, so that folks can comment on it and get a final rule published as quickly as we can, perhaps before the end of the fiscal year. But the crystal ball on reauthorization is pretty foggy, and I wouldn't even imagine predicting a date. We'd love Congress to take this priority up. I know that the chair of both the House Education and Workforce Committee and the chair of the Senate Agriculture Committee would like to move forward. And I think there's some indication of bipartisan support, particularly on the Senate side, but you know, name the day, name the month, I don't know.
How about the crystal balls of others of you on the panel? Anybody got any clarity on that? Okay. No one wants to make, go ahead. Go ahead, Rochelle.
No, I don't.
No one wants to make predictions in Washington these days. It's too risky. I totally understand that. We are reaching the end of our time together, so I'm going to close the program out by asking each of you do a little bit of a lightning round here. And the question for you is, if you only had one piece of information from what we've talked about today that you'd want our audience to take away from what we've discussed, what would it be? Dr. Gracia, let's start with you.
I would say that the imperative is now, that the opportunity is now really to invest in our children, and that we have such important programs and policies that can truly help to advance children's health and well-being, to address these long-standing challenges of child hunger and food insecurity, and that we shouldn't accept that any child can be hungry in our nation, that any child is in a food insecure household, because that impacts not only that child, but that child's future and the future of our nation. And so when we look at opportunities such as transformative policies like the Healthy School Meals for All, or expanding the community eligibility provision, we have the opportunity to expand access and improve food security among our nation's children. We have the opportunity to move us further towards advancing health equity. And it's going to take all of us. It's going to take congressional action. It's going to take executive branch action. It will take those of us in the nonprofit sector, the private sector, working together, not only in public health, but also across education and transportation, housing, and many others, to really commit to this. And that investment is going to pay off in the future so that our children can thrive and that we can truly be a healthy and prosperous nation.
Thank you. Rochelle?
Very simply, providing access to healthy food is a smart and ethical investment.
Reverend Greenaway.
I would urge everyone to call Secretary Vilsack and get that proposed rule on the WIC food package out by the end of March.
Lieutenant General Hurtling.
Yeah, I'm going to go a little bit deeper, Leslie, and say that we have a lot of concerns about the health of our nation. And the three pieces of the three legs of the stool regarding the health of our nation have to do with activity, sleep, and nutrition. We have to really address the first two on our own as individuals, you know, how much we exercise, how much sleep we get every night. The nutritional piece is affected by so many other factors. And I think if we really want to look at the long-term health of our nation, the Policy Commission's recommendations on these nutritional items are critically important, not just for the short term during the pandemic, but in the long term of making sure we have a healthy citizenry in the United States.
Thank you so much. And let me thank all four of you for sharing your wisdom, your knowledge, and your time this afternoon, as well as all of the time and energy you're putting into the task force's work. So with that, I thank you, and I turn the program back to Bill Hoagland.
Thank you, Leslie. And again, thank you, Rochelle Davis, Reverend Greenaway, Dr. Gracia, General Hurtling. Thank you, Chef Andres and Secretaries Glickman and Benneman for your leadership and dedication to this work. As I said at the outset, historically, reauthorizing the child nutrition programs has been a bipartisan effort, and we are hopeful that the task force's recommendations can help advance another bipartisan approach to the reauthorization of these programs, or as Reverend Greenaway has indicated, through executive decisions that authorities already exist. This is not the end of our work. I mentioned this is the second of three briefs. The task force now is turning its attention to the upcoming Farm Bill's reauthorization, another reauthorization next year, by focusing on the nutrition title in that bill, which includes, of course, the SNAP program or food stamps. Before we close out here, let me particularly thank the BPC staff who worked tirelessly on this brief, our Chief Medical Advisor, Dr. Anand Parekh, Michael Lovegrove, Thomas Armuth, and our dedicated consultants, Melissa Maiden-Shepherd and Stephanie Hodges. And of course, none of today's presentation could have been possible without the assistance of BPC's events and production team, Mary Margaret Holton, Jen Ruff, Winton Henderson, Elizabeth Hall, and of course to the producer of this event, Greg Gibson. Thank you all, and have a good day.